Hey everyone, we've got another specimen today. This is 803 in our collection. The heart would have sat in the chest roughly like this. This would have been the anterior surface, posterior towards the turntable, superior and head up here, inferior legs down here, left over here, right over here. So let's do what we always do, find the right atrial appendage and try to get started there. And it looks like externally maybe this is the right atrial appendage, so we'll go ahead and open the heart there. And when we open up this appendage, we do see pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. And then if we look at the other structures, we do see the oval fossa here. And there is a defect in the oval fossa, so there is an atrial septal defect of the oval fossa variety. And then we find the coronary sinus here, or the mouth of the coronary sinus. And if we were to identify the triangle of Koch, then tendon of Totaro, mouth of the coronary sinus, atrioventricular valve, triangle of Koch would be here, and the apex would be somewhere here. Obviously, looking at this location, we could see that there would be no way really that an AV node could sit here, or that bundles could then penetrate down into the ventricles, which highlights in this heart, or this kind of category of hearts of double inlet, which we'll find out next, that in fact the atrioventricular conduction axis is altered and sits in a different location. And we will cover that in a different video just because I think that deserves more time. Nonetheless, this right atrium does have an atrioventricular valve here. It appears to have two leaflets. Maybe there's a third, it's hard to tell if these are two or three separate leaflets. And this opens up into a large ventricle, which appears to be a morphologic left ventricle. You can see fine crisscross trabeculations here, fine crisscross trabeculations here. And then as we look at this ventricle, we find that there in fact is another AV valve that opens up into it. So pretty early on now, we can see we're dealing with double inlet left ventricle. So this was the AV valve we already saw connecting the right atrium to the morphologic left ventricle. And then here is a separate atrioventricular valve that connects what would be the left atrium to the morphologic left ventricle. So why don't we go ahead and take a look real quick at the other atrium. And here is a more smooth-walled atrium. And here is the oval fossa from this side. And here you can see the horns of the oval fossa here. And then we see the opening to the left atrial appendage, and we can see all the pectinate muscles are actually confined within the appendage itself, consistent with a morphologic left atrium. Here, guarding this connection between the left atrium and the morphologic left ventricle is another atrioventricular valve, which also appears to have, there's at least two leaflets, and it's hard to tell if there's a third separate leaflet here that's small, that's been cut apart, but it looks like this is potentially also a three leaflet atrioventricular valve, but it's somewhat hard to tell. So right off the bat now, we've got double inlet left ventricle. We've identified the two atriums. We've also identified the two atrioventricular valves. So now we should try to find our outlets. And the first thing we can do is find the small incomplete right ventricle, which is here. So here is the small incomplete right ventricle. And here is the ventricular septal defect leading to the morphologic left ventricle. Okay, so here is the ventricular septal defect. Here is the morphologic right ventricle. And then from this morphologic right ventricle arises a large great vessel. There's a semilunar valve here that has three leaflets, 1, 2, 3, and 3 sinuses. And we see from within these sinuses, there are coronary arteries arising. So here's one coronary artery, and here's the other. Okay, so this is the ascending aorta, this is the aortic valve, and this aortic valve appears to be entirely supported by muscle. There is no fibrous continuity with either atrioventricular valve and this valve. And as we've pointed out before, remember, as with the semilunar valves, the true annulus of these valves is actually crown-shaped because of the semilunar hinge pattern, and there's actually muscular triangles of musculature that interpose between the valvar leaflets here. And then close but arising from the morphologic left ventricle is now the pulmonary trunk. So smaller than the aortic outflow. Here's the pulmonary outflow. And we'll put our probe through it. And so here is, in fact, the pulmonary outflow. So morphologic left ventricle, morphologic right ventricle. From the morphologic left ventricle arises the pulmonary outflow, and from the morphologic right ventricle arises the aorta. So in this heart, we have normally related or usual arrangement of the atriums. We've got a double inlet left ventricle. We've got discordant ventriculo-arterial connections, and then non-spiraling great arteries. So a heart with double inlet left ventricle.